Hi, I'm Liz Hare. I do quantitative genetics and statistical analysis for working dog organizations. My first IWDBA conference was 20 years ago on 9/11. It was an unforgettable day, and I'm looking forward to catching up with everyone who was there and to meeting new people who share our interests in working dog science. I'm going to talk about the agreement between foster and trainer assessments of behaviors of puppies at the Penn Vet Working Dog Center during their development. My colleagues for this and a broader project on developmental genetics and behavior are Doctors Jenny Essler, Cindy Otto, and James Serple. The Working Dog Center program is interesting because pups arrive at 8 weeks old and they begin training immediately and are assigned to foster families. The dogs come from two sources. The Penn Vet Working Dog Center detector dog breeding program has Labrador retrievers and Dutch shepherds, and external breeders donate pups from families with known working ability who pass breed-specific health screenings. They are generally herding and sporting breeds. During puppy development, they live with their fosters and they attend the center all day on weekdays. They are trained in several areas, including Fit to Work, which is a fitness and exercise and health program established at the center, agility, obedience, and a search for people and objects. The pups receive intensive observation and interaction while they're in training. Career choices are based on formal assessments as well as daily observation of the pups by the trainers. The pups can be trained in one of several detector dog disciplines like search and rescue, narcotics, or explosives detection. And because of this flexibility, the success rate is 93%. The formal assessments that are used include questionnaires like the Canine Behavior Research Questionnaire, or C-BARQ, and the BCL, or Behavior Checklist. There are also behavior tests aimed at exploring dogs' interactions with trainers and reward toy objects, as well as their responses to various environmental stimuli. The C-BARQ contains 100 items. Most of them cluster into one of 14 subscales. There are some miscellaneous items that don't cluster with other items. Most of them are behaviors that are considered problems, with the exception of trainability. The scores on the C-BARQ items range from 0 to 4, and they refer to the frequency or intensity of behavior. A score of 0 would indicate a behavior that doesn't happen at all or doesn't have any intensity. 1 seldom occurs or has mild intensity. 2 sometimes occurs or has moderate intensity. 3 usually occurs or the intensity is between moderate and extreme. 4 is a behavior that always occurs or has an extreme intensity. Each subscale score is the mean of the items in that subscale. The entire subscale score was missing if less than 70% of the items were filled out. The BCL contains 43 items. They don't cluster. They are often broader than C-BARQ items, but sometimes overlap with the subscales. The behaviors are also rated from 0 to 4 in intensity. 0 is a behavior that's absent. 1 is a behavior that is very mild. 2 is a behavior that is mild. 3 is a behavior that is moderate, and 4 is severe. To process the data for this study, we assigned each assessment to an age group. There were 3 age groups consistent with how C-BARQs have been studied in the past. The age groups are up to 9 months, 9 months to 2 years, and over 2 years. If there was more than 1 assessment per dog per age category, we selected 1 at random. We then matched C-BARQ and BCL records by dog and by age group. We ended up with 39 dogs in the youngest age category, 64 dogs in the intermediate age category, and 5 dogs in the oldest age category. To measure how closely trainers and fosters agreed, we used Spearman correlations with the home correction for multiple testing. We considered results significant if the p-value was less than 0.05. We did 2 sets of tests. One correlated the C-BARQ subscales with BCL individual items. The other looked at all of the individual C-BARQ items with the BCL items. When we looked at the C-BARQ subscales and the BCL items, there were 3 significant correlations. BCL, stranger-directed aggression, was correlated with C-BARQ, stranger-directed aggression, at 0.49. BCL, stranger-directed aggression with C-BARQ, dog-directed aggression, 0.42. BCL, resource guarding around dogs, and C-BARQ, dog-directed aggression, 0.46. When we looked at all the individual C-BARQ items, there were 9 significant correlations. The first set of them is in the domain of dog-directed aggression. BCL, dog-directed aggression, and C-BARQ, aggression when approached by a male dog, 0.48. BCL, dog-directed aggression. C-BARQ, approached directly by a female dog, 0.49. BCL, dog-directed aggression. C-BARQ, aggression when barked, growled, or lunged at, 0.42. BCL, resource guarding around dogs. C-BARQ, aggression when approached directly by an unfamiliar female dog, 0.50. BCL, resource guarding around dogs. C-BARQ, aggression when barked, growled, or lunged at, 0.47. The second cluster of significant correlations was for stranger-directed aggression. BCL, stranger-directed fear. C-BARQ, aggression when approached directly by an unfamiliar adult, 0.39. BCL, stranger-directed fear, and C-BARQ, fear when approached by an unfamiliar child, 0.43, BCL, stranger-directed aggression, and C-BARQ, approached by an unfamiliar adult, 0.46. There was one significant correlation in the touch sensitivity area. BCL, the dog retreats when reached for, and C-BARQ, having the nails cut by a household member, was 0.58. We didn't find correlations for a whole lot of other behavior domains, including trainability, interdog rivalry, chasing, excitability, attention seeking, energy, and a cluster of fear and aggression, including owner-directed aggression, dog-directed fear, stranger-directed fear, and non-social fear. In thinking about why we don't find many correlations, and the ones we do find are kind of low, between 0.4 and 0.5, one suggestion for an explanation comes from Dr. Otto. The dogs behave very differently at home and at the center, where they have all kinds of activities and exercise, both mental and physical exercise. And so maybe at home they're calmer and a little bit more relaxing and recovering. Some other reasons include the fact that fosters and trainers may have different frameworks for assessing behavior and rating which behaviors are desirable. And also the C-BARQ items are more granular, and many of the BCL items are more specific. Limitations for this study are that we are missing some data from dogs early in the PennVet Working Dog Center operation. Often in studies of behavior in working dogs, we want to see how these behaviors, how well they predict the success as a working dog. We can't really do this with the dogs at the center because 93% of them are successful. The dogs have the potential to be successful or to fail at multiple careers. There's also confounding between the careers chosen by the trainers for a dog and the way that they fill out the assessment. So what's next in our work? There is a detector dog specific version of the C-BARQ in development. We would like to, as we get more data, look at the other factors that would affect behavior, demographic factors like sex, breed, and age, and also environmental factors like what discipline they're being trained for and what kinds of things they're exposed to as they're growing up. Thank you very much to everybody at the Working Dog Center, the trainers and the fosters who provided us with all of this data to analyze, and to the IWDBA organizing and scientific committees for the invitation to present this work, to Dr. Sylvia Canelone for the theme and some additional work on the slides, and Dr. Angela Baldo for the alt text descriptions of all the photos. I'm looking forward to talking to everyone more informally about this work. Thank you.